Welcome back. My next guest is Dr. Tony Rogers, who is a cardiothoracic surgeon. Welcome, Dr. Rogers. Now, you actually operate on the heart.
Correct.
And
yes,
we've talked about heart attacks, but a lot of people have heard the term heart murmur, which is a sound which may indicate a bad heart valve. Tell me what heart murmur and heart valve, what that means.
Well, heart valves are structures in the heart that control the flow of blood, and it makes it go one direction. So when a valve is functioning properly, the heart moves the blood through without any turbulence or any sound other than just the normal valve sounds. But when the heart valves become diseased, whether through age, whether through just the wear and tear of time, or perhaps through rheumatic fever or inflammation, then there is turbulence in the blood, and that causes an abnormal sound, which we would call a heart murmur.
And that indicates a possibly bad valve.
Possibly, but a lot of people have heart murmurs, and some people go through their entire life with a heart murmur and really don't have symptoms, but it certainly should be checked.
Now, if they do have symptoms, what would they be?
Well, for a lot of people, it depends on the valve. Let's say for aortic stenosis, a person who has significant aortic stenosis would be very tired, fatigued. They might develop chest pain. They might develop faintness, or what we would call syncope, and sometimes they get palpitations. Those are a few of the symptoms, and occasionally chest pain.
But now, you mentioned the aortic valve. That's just one of the different valves in the heart, but it's a pretty important valve. And there's a new procedure, I don't know if it's new, but it sure is interesting and easy, called Tavor. Am I getting that right?
Correct. It's relatively new in America, but it's been in Europe, it's been out for several years. It's what we call transcatheter aortic valve replacement, Tavor, T-A-V-R. And we've been doing them about a year and a half in this country, since November of 2011 when they were released.
Now, you said transcatheter. That's different from operation.
It's an operation, but it's a minimally invasive type operation where you actually go through a puncture site in a blood vessel or in the heart to position a valve, rather than actually cutting the chest open in the big way that we traditionally have done it for traditional aortic valve replacement.
Who's a candidate for something like that?
Currently, the people that are candidates for the Tavor type procedure would be a person who would not be a candidate for the open procedure. You would have to be what we would call a high-risk patient, a patient who might have what we would call morbidities, might have bad lungs, might have kidney failure, or other things that would make them a very high-risk surgical candidate for the traditional bigger operation. So those patients would need to be evaluated. They actually have to be evaluated by several people. Two cardiac surgeons need to evaluate those people and come to the conclusion that they are acceptable for the procedure. There's a lot of criteria that currently we're required to jump through to make these patients acceptable to the government for these procedures.
Okay. Now, when you say a cardiac thoracic surgeon, you do the valves, you do the Tavor, you do heart bypass surgery, but you also do lung surgery. And in Kentucky, we have a lot of lung cancer. Actually,
we're #1, and that's a sad statistic, but that's the reality that we face in this country. In Kentucky particularly, about 33% of our population, adult population, are smokers.
Now, you do robotic lung operations?
Yes, robots have been used surgically for quite some time. It's been used in GYN and for prostate-type surgeries in urology. But in the last couple of 3 years, or even a little bit longer, in certain centers, robotic lung surgery has taken off. And we're doing that at Baptist Health here in Lexington. Patients that might be candidates for robotic lung surgery would be a person that would be in an early stage, what we would call stage 1 or stage 2 lung cancer, or a patient that might need a lung biopsy or something along those lines. The advantages of robotic lung surgery are that there's much less pain associated with the procedure. The patients are able to get up and get back to normal activities much quicker, and as I said, less pain. So those are some potentially very important issues that would favor the use of robotic surgery in the future.
And if you're going to use robotic surgery, you want to do it, you mentioned stage 1 and 2, so you want to catch the disease early. What are some warning signs that might be a lung cancer, not necessarily lung cancer, but something you ought to go get checked out?
That is the difficulty of lung cancer. There are no early warning signals for lung cancer in itself. Sometimes the patient presents with a respiratory illness such as a bronchitis or they might be in a traumatic accident and they would get a chest x-ray. So many of the early stage lung cancers are actually found incidentally when you have other procedures done. So there's also currently being investigated, and there is some recommendations in the country today that people who are at high risk, older people who have smoked for a certain number of pack years, should have what we call a CAT scan on a certain, like every year or two. There's a lot of debate about this. It certainly has not been accepted completely, but that is being debated across our country. The downside of this is going to be radiation exposure to the patient, and there's also a significant cost to the patient and to the government.
Well, thanks for coming in. Thanks for telling us about valve surgery, TAVR, lung surgery. We appreciate it. We'll be right back.